Hello friends, today topic is cardiopulmonary resuscitation. Step by step friends, don't miss it. Move on to topic. Before topic, just small request friends, please like the video and share the video and subscribe my channel. The cardiopulmonary resuscitation. Index is introduction, definition, purposes, indications, types of CPR and procedure. The introduction of CPR. CPR is a life-saving procedure. It is defined as chest compressions and ventilation. The time interval between collapse to initiation CPR and collapse to defibrillation is most important. It is consist of BLS and ALS. The definition of CPR is cardiopulmonary resuscitation is a basic emergency procedure for life support consisting of artificial respiration and external cardiac massage. Purposes: to establish effective ventilation and circulation, to prevent irreversible brain damage, and to prevent a mortality rate. See friends, here CPR is going on. Patient is in unconscious, unresponsive. CPR is going on. This is the CPR procedure. Small video clip friends. Move on to indication friends. The respiratory arrest resulting from, actually here some conditions is there: drowning, stroke, foreign body, drug overdose, smoke inhalation, suffocation, myocardial infarction and coma. Drowning will have occurred in kids friends, most common in kids. Stroke, like here some pictures is there: drowning, stroke, drug overdose and suffocation. And also myocardial infarction, the blood supply, ischemic condition. This is one of the heart disease friends. Till now we seen in respiratory arrest results friends. Next, cardiac arrest. Second one is sudden and complete loss of cardiac function, the sudden collapse with loss of consciousness, the pulse absent and no respiration. Pulse we have to check not peripheral friends, femoral and carotid friends, carotid pulse. You can see here some picture friends. This is a type of indication, cardiac arrest. Next, note: if CPR is not given within 4 to 6 minutes, death may occur. Next, move on to types friends. Types of CPR: basic life support and advanced life support. The basic life support is the sequence of procedures performed to restore the circulation of oxygenated blood after the sudden pulmonary or cardiac arrest friends. Chest compressions and pulmonary ventilation performed by anyone who knows the procedure. They have to start immediately without any equipments. This is a life-saving procedure. Actually we have to start CPR is in within 4 to 6 minutes friends. This is the basic time. This is a emergency crucial time also. Aims: the basic life support aims to ensure open airway and adequate ventilation, to maintain circulation until help comes, treatment with continuous. The advanced life support, when the helper will come, we have to administer ALS, advanced life support. Till now we have seen basic life support. Now move on to second one, advanced life support. The advanced life support is a airway secured with a advanced technology. Breathing is maintained with some of breathing apparatus, and circulation is maintained by basic life support along with IV access and defibrillator and appropriate drugs. For example, here we can see picture with defibrillator and help ambubia, with help of ambubia. Helper also is there, defibrillator also connected here. Next, move on to procedure, CPR procedure. CPR procedure is a easy as CAB. Compressions means chest compressions, airway and breathing. CAB. C compressions, A airway, B breathing. These three are must and should we have to follow. Now we will do CAB step by step. Chest compressions. The rhythmic application of pressure over the lower half of the sternum in the chest. Okay. Kneel as close to the side of the victim's chest as soon as possible. Place your one hand into the center of the victim's chest between the nipples. Next, second hand you have to place top of first hand and interlock the fingers and direct her away from the secure. In this picture you can observe. Till now we have seen adult friends. In children's chest compression in children's it is done with one hand, where as in infants it done in with two fingers, friend, index finger and middle finger. You can observe in this picture. Next, chest compressions rate should be 100 compressions for a minute with a compressions depth 1.5 inches, 5 centimeters in adult, child 4 centimeters, neonate 3 centimeters. The ratio should be 30 compressions to ventilations. The compression rate, chest compression rate should be 100 compressions per minute. Depth adult, child, neonate is different. Small video clip, CPR video clip in adult friends. We have to allow chest return to its normal position completely after each compressions with equal compressions with and relaxations also. Assess after 1 minute if circulation is present. Stop compressions. Here in infant with two fingers, here CPR is going on. This is ventilation, friends. With two fingers, index and middle finger, the CPR done by neonate. In children's, CPR will give with one hand. In infants, with two fingers, index finger and middle finger, friends. You can see here CPR in infants. Till there is no response, check the air. The second step is airway, friends. Airway. Assess for any visible obstructions in airway. Clear airway by removing any loose obstruction in the mouth and pharynx. Loose obstructions means here mucous, blood and foreign body will come. In case of unconscious victim, tongue is most common cause of airway obstruction. If the victim is still not breathing, then open airway by head tilt and chin lift. If it is a suspended for the spinal injury, and we can use supine position for spinal injury patients. Victim is still not breathing on own after airway, then assist him breathing. Here we can see head tilt and chin lift method and mouth to mouth ventilation. Here we can see the small video clip, friends. Head lift, head tilt and chin lift. This is one of the second method. Compressions, airway, breathing. In airway, tilt the victim's head back and lift the chin to open the airway. Compressions is going on continuously, 30 compressions to breathings. There is no breathing pattern, we have to assess breathing. Look, listen, feel, place the ear over the victim's mouth and nose. Look towards the victim chest and stomach, and chest is raising or not we have to observe. Then pinch the nostrils closed with the thumb and index finger of the hand that is on forehead. Take deep breath, open with mouth with a wide place outside of the victim's mouth, making tight seal 2 full breaths each breath over 1 second. Allow victim's lungs to relax. This is the note in assess breathing. Avoid rapid and forceful breathing. Rate should be maintained 10 to 12 breaths per minute. This continue ratio will be 30:2, friends. 30 compressions, 2 rescue breaths. It is the until spontaneous circulation we have to continue, observe, and we have to assess breathing. The guidelines for termination of resuscitation. Termination means we have to stop. When we have to stop the CPR, return of spontaneous circulation of the victim, arrival of rescue team or medical help when death is confirmed. That time only we have to stop the CPR. Thank you friends. Thank you for watching. Please subscribe my channel. Please the like video.